So what are some benefits of targeted therapy and why it's really important to know if the cancer belongs to one of these groups? Well, first of all, this is specific to the cancer subgroup. So now we're not treating, one cancer just like the other. We know now that there are different types of non-small cell lung cancer, so we want to offer the best therapy for the right subgroup. Often these targeted therapies can be in oral pills. That is not true for all, but case for many of them, and that does improve quality of life. You do not have to go to the infusion center every couple of weeks, wait for parking, things like that. It is simply pills that you take once or twice a day. And as Dr. Ota also talked about in her talk about EGFR, but this is also the case with many of the other molecular subgroups. Many of these targeted therapies have excellent brain penetrance. So not only can they treat brain metastases if they exist, but more importantly, prevent brain metastases from occurring, which is quite important. So my big takeaway points today. So non-small cell lung cancer is divided into many molecular subgroups. We have now effective targeted therapies that are available against these mutations. They lead to an improved overall survival. They're often better tolerated. But thankfully, these targeted therapies are not just for stage 4 lung cancer anymore. We're seeing more and more that there's a benefit to using these targeted therapies in earlier stage lung cancer, whether patients have undergone surgical resection or definitive chemoradiation. But again, I think my major takeaway point today is that we need to consider next generation sequencing for all of our patients with non-small cell lung cancer because we cannot know about the role of about targeted therapy unless we know about the subgroup of lung cancer. That'll help us come up with the optimal treating plan. And so with that, I want to thank you for your attention.